This foam rolling fitness sequence uses a variety of foam rollers, and it's up to you which ones you use. And as you hold each stretch or move your body over the foam roller, do it for 15, 30 seconds, even a minute, maybe even 2 minutes. Foam rollers help give you a good myofascial stretch. And sometimes our myofascial stretches need to last about 2 minutes to really dig deep into the fascia layers that surround the muscles. Often when you initially use the foam rollers, it may be uncomfortable. Take your time and do the best that you can. Here I'm putting this foam roller between my hips and my ribs, laying on the side, and now I'm putting my body into this position, which helps stretch my lower back, my upper back, and my hip flexors. The further you put your arm overhead, the further you put your front knee out in front of you, the further you bring your top knee behind you, the greater the stretch. And breathe into that foam roller. Again, you're going to hold this for 30 seconds to a minute, however long you can tolerate at this point. And as you progressively increase doing this, your tolerance should improve. Now we switch and we do the other side. Now we move into thoracic mobility, where I lay on top of the foam roller in this horizontal position. And some people also do this in a vertical position, and you can do both as well. And I glide over it to help mobilize my lumbar spine. Now I'm going to just rest with the foam roller just at the base of my shoulder blades. Reach my hands overhead, let the stretch work its magic, and hold this for as long as I can tolerate, sometimes even up to 2 to 3 minutes. The first two stretches of this video, the side lying and this one, are probably the most important ones that you can do. These first two mobility sequences of the foam roller, the side lying and now this thoracic mobility, probably the top two exercises that you can do with the foam roller. Now we proceed to mobilize some of the muscles of the lower hip. Here I'm using the harder black foam roller to start on the quads, rolling my thighs up and down on these quads. This is not the most comfortable thing, and so it takes some tolerance to do this. So do the best that you can. Now we progress to mobilizing the muscles around the hip. Here I'm doing the iliotibial band. This one is usually quite uncomfortable, and it does take some upper body strength. Do the best that you can, and the more you do it, the less uncomfortable it should become. Now I move to the posterior hip, the buttocks, working on the gluteus maximus as well as the piriformis muscle. Okay, I can slide over it, or I can rest on it and let the foam roller sort of dig into some of the tender spots. In here I show using the black foam roller, a little bit firmer again than the blue, to not only mobilize my butt muscle, the piriformis and gluteus maximus, but also work its way down the posterior leg, going down the hamstring, as well as the calf muscle. Again, I'll be doing this for maybe 30 seconds to a minute, even 2 minutes down the entire leg. Now I switch sides, switch legs, start working on the quadricep here. Do the best that you can again. The more you do this, the easier it gets. Then I switch over to the opposite iliotibial band. And you see I'm switching between foam rollers. You don't have to do this. In fact, you can use the white one for all of these things because the white one's firmness is between this blue one and the black one. And then I use the black one here to roll my posterior hip, the gluteus maximus, down the posterior leg, down the hamstring, as well as down to the calf muscle. The next exercise is actually the hardest one to do, trying to foam roll the inner thigh, the adductor muscles. This takes time and patience, so give it your best shot. Now that we've mobilized the upper back, lower back, hips, and all the muscles of the lower extremity, we're now going to move into doing core stability using the foam roller. This is some advanced core stability exercises, so please be familiar with my Core 4 and my Core 4 Max sequence in the core stability section. So find spinal neutral and hip neutral by tilting your hips up and down. And once you've found that, we're going to place the foam roller as shown. This will take time and energy, and that foam roller will fall off your back a lot. But the goal is trying to get your spine as flat as possible. And as you notice, the foam roller is touching my lower back as well as my head. Now I'll do a variety of alternating movements, lifting my hands off the floor, lifting a foot off the floor, always trying to keep that foam roller between my shoulder blades and touching the back of my spine down to my hips and keeping it on my head. Now this is called the bird dog, where you lift one foot and the alternate arm. This is sort of the crawling position as explained in my foundational mobility assessment videos. If the foam roller falls down, pick it back up, try to find spinal neutral, get the foam roller touching your head between your shoulder blades and touching the low portion of your back, and keep at it. And now I'm adding a crawl, very deliberate, slow crawl. So this is something I'm still working on. A higher level of challenge would be holding a plank, which is this, and then going into a push-up, keeping the foam roller stable on your spine, and then trying to return back to all four position with the foam roller as aligned on your spine as possible. Spend about 5 to 7 minutes doing these variety of exercises with the foam rollers on your back. Take your time and rest, and then repeat. Now I'm demonstrating different types of push-ups and planks that can be done on a foam roller. Do as many push-ups as you can, and here's an A-frame, and putting yourself into the cobra, the arch. You then can go into an uneven push-up, and it's demonstrated with one hand on the floor and one hand on the foam roller. Again, you can use a plank position, you can put your knees on the floor as well. Do the challenge that best fits your current fitness level. But remember, the goal of any exercises is to improve your fitness by progressively increasing the challenge and increasing your mobility, strength, endurance, and balance. Here are the same set of core stability exercises, but done from a different video angle. Just do the best that you can. Again, if you can't do a full plank, like lifting your knees off the floor, put your knees a little bit further behind than your hips, which is a kneeling plank. and progress from there. Just steadily increase the challenges every day, and over a couple weeks, you can progressively be getting better and better. Obviously, I'm still working on keeping that perfect balance with the foam roller, but fitness is always a work in progress. Next, we're going to go back to a little bit of spinal mobility and shoulder mobility by doing the child's pose using a foam roller. And the foam roller does go out of the screen, but you can see how I'm bending forward and gliding forwards and backwards. And this move I put at the end of this sequence because the next thing we do is trying to improve the squat. And oftentimes our latissimus dorsi, our upper back muscles, are so tight it makes it hard for us to do a good squat. So I like to do this exercise right before I move into squats. Now after you've mobilized your upper back, you can take the foam roller, this long one, this is a 3-foot one, put it overhead, and you could use a broomstick if you need to. And now this has helped maintaining as tight of a back and upright back as I can. Now, to decrease the challenge, I can put it on my shoulders. But my goal is to squat down, try not to lean forward too much, don't have to lean backwards too much or I'll fall down. Keep the knees gliding over the toes, not turning inward. When I'm in the upright standing position, I should be able to lift my toes off the floor, but I feel the pressure in my heels. It is vitally important for good low back stability, strength, endurance, and balance to improve your squat. As you do these foam roller exercises, the ability to squat down, to have your knees go over your toes, to be able to feel like you're sitting down should become easier and easier. And this could take weeks, but do the best that you can. And you can review my squat videos for more information, as well as my hip stability exercises sequences. This last exercise strengthens up the hips, and you do a single leg stance while bending forward. Do the best that you can. Some people may be very difficult to do, so you can skip this until your balance improves. And you can look at my balance sequences as well. The foam roller pushing against my foot has several purposes. One is to try to keep my rear foot going straight backwards, but it also can be used as a leverage to keep my body stiff and tight, to tighten up my core so that I can bend forward. Do 5 or 10 of these and then switch sides.